The first case we have today is a case that was sent to us by Aaron Smith, who is one of our physician assistants. The case occurred literally 2 days after we did a course on ultrasound for the physician assistants, and from what she learned and she remembered, she then tried to apply what she learned, and this was her case. She had a 72-year-old that came in who had lower back pain and upper abdominal pain. It's been going on for 1 week, started right after the patient was shoveling, so he thought it was all musculoskeletal. Tried some Motrin, which didn't really make a difference, and so the fact that it became constant and was in the upper abdomen, he decided to come to the ER. Aaron saw him, said he looked very, very well. No vital signs or physical exam is up here because per her they were normal and really had a benign abdomen, so there wasn't much to report. She thought about doing labs, doing a CT, maybe having the patient to start drinking using both PO and IV contrast. But as I said before, she remembered the course that we had on ultrasound, and so she went. She tried to find our nearest ultrasound, and she went to the bedside and took a look at the patient, and here's what she found. You can notice on this image right here, this black shadow, which is the spine that indicate that Aaron is in the right spot. And she sees this large circular structure. When she freezes the image, she finds here a 7.71 centimeter AAA. Again, you see the spine here, which is dark, indicating that she is in the right spot. In long axis, you can see here, you have the normal aorta here with the spine down below, indicating that she's in the right spot, and then the aneurysm right here. One more clip for you guys. So the outcome of the case, once Aaron had these clips, showed them to the attending, they rushed the patient to CT for operative planning for the surgeons. They then decided, based on the anatomy where the aneurysm was located, to proceed with EVAR. After the procedure and completion, patient was extubated, went to the ICU, then to the floor, and at this time is at rehab, recovering from the procedure. Just to go over a couple things with AAA, 5% of the general population over 65 will have an abdominal aortic aneurysm. That can be 3.5 centimeters, 4 centimeters, but it's relatively common. It's not minuscule. It's not 0 or 1%. So it's something you have to think about in males, those over 65 years old, or smokers. One thing we try to stress to our residents and to the physician assistants who work with us is that any abdominal pain in the elderly should be thought of as a AAA until proven otherwise. And as such, those over 65, we try to convince them, if they have nonspecific abdominal pain, to first grab the ultrasound before you do any testing, and to make sure that this is either a AAA or that you can just cross it off your mind and not put it in your differential. So that's it. Hope this helps. Please feel free to email us with any comments if you need or any questions. And also, please send us cases that you may have at your institution. Our email address is mghedus@gmail.com. Hope this case was helpful. Take care.